So our first guest of honor tonight, who came to us all the way from Arizona, is Dr. Jeff Singer. Dr. Singer is a senior fellow at the Cato Institute in the Department of Health Policy Studies. He's also president emeritus and founder at Valley Surgical Clinics Limited, the largest and oldest group private practice in the state of Arizona. He's been in private practice as a general surgeon for more than 35 years. As most of you already know, Jeff has been an indefatigable and highly successful champion of high-quality, comprehensive care for so many in our communities who have not had access to mental health care. Dr. Singer believes that psychologists' prescriptive authority, as a matter of good public policy, can help to solve our national, international mental health shortage crisis. And now it's my great pleasure to present to you Dr. Jeff Singer.
Thank you.
Thank you.
I've gotten involved. I'm a surgeon and I'm still in practice, although I'm now part-time and I work full-time at the Cato Institute in Washington. And the reason I got involved with this issue is because, for philosophical reasons, I think that occupational licensing laws in general, including professional licensing laws, really are designed to keep out new entrants and to protect entrenched incumbents, and that everybody has a right to earn an honest living, and every consumer has a right to consume services from any person they choose. So it's for philosophical reasons that I got involved in this, and I actually published a briefing paper on prescribing psychologists almost a year ago now. And through that actually is, I think, how I met Beth, because I then organized a policy forum online about it, and I asked Beth to be a participant, just to give you an idea of how licensing laws work. So I'm licensed to practice medicine in the state of Arizona, and this would apply in all of the states. So Beth was kind. I'm a surgeon now for 40 years, not more than 35 years, although they're both true. But anyway, so if I decided after 40 years of this being a general surgeon, I just need a new challenge. And I've been reading a lot of psychiatry literature lately. I think I want to be a psychiatrist. I'm going to change the name on the sign on my door to Jeffrey Singer, MD, Psychiatry. That's totally legal because that's in my scope of practice as a licensed medical doctor. Nothing could stop me from doing that. And people could walk in off the street and I could, try to develop a practice by word of mouth. But you know what's protecting the consumer? Well, next I contact the hospital that I go to, and I would tell them I'd like to have psychiatric consulting privileges at the hospital so that if a person comes in, let's say a suicide attempt, I could consult. And they'll bring it up before the hospital's credentials committee, and the first thing they're going to ask me is where I did my psychiatry training and if I'm board certified. And when I tell them, no, but I took a lot of CME courses and I really feel like I could do this. And they'd say, well, great, when you finish a residency and become eligible to take the boards, come back and we'll discuss it. Then the next thing I think of, gee, I better contact my malpractice insurance carrier because I'm covered for surgical malpractice, but if I get into trouble practicing psychiatry, I need coverage. So I contact them and they're going to ask me the same questions. And they're going to say, we're happy to cover you for any surgical malpractice events that may occur, but when it comes to practicing psychiatry, you're on your own. Then I contact Blue Cross of Arizona and Cigna and Aetna, and I say, I'd like to be included on your panel of mental health professionals because I'm going into psychiatry. And they'd ask me the same questions, and they say, well, we require you to be at least board eligible, if not board certified, to be on our panel. So who's protecting the consumers? These are all private organizations. It's in their best interest to vet people. And so I've always believed that people need information, but we don't need to have a monopoly by the state, which is subject to political pressure, to do that. All of my having a medical license, all that does is tell you that I graduated from accredited medical school and I'm not a convicted felon. But the hospital would have checked that out also, and so would have my malpractice carrier and all the other entities I talked about. So it's for that reason that when I learned about, actually through an Arizona legislator who actually alerted me to this. I wasn't even aware of, even though I have a daughter who's a PsyD in private practice in LA, not doing prescriptive. Obviously, California doesn't allow it, but it's not out of personal bias because of that. It's just out of my interest for healthcare public policy. So when this state senator alerted me to this, I started getting involved in studying it, and then I published the policy brief on it. I think it's very important to get the entrenched incumbents out of the way and get the scope of practice laws out of the way. There are a whole lot of, obviously it's not a panacea for the mental health problems in our country right now, but by expanding the number, the workforce of people who can prescribe and perform psychotherapy, we'd be doing a great service to the public. And right now, in all but 6 states and the territory of Guam, people are being denied that opportunity. So that's been my motivation.
Thank you so much. So we are so grateful to you for all of the testimony that you've given on our public health crisis and how Psychologists' Prescriptive Authority is an important public health initiative, and for all the numerous articles that you've written with beautiful, logical clarity, arguing for prescriptive authority as good public policy, for giving many of us the opportunity to speak at top Cato events, for seizing every opportunity to speak with federal legislators about the critical need for more comprehensive and better access for mental health care, and for your enthusiasm. Isn't he great? So for all of this and much more, the Illinois Association of Prescribing Psychologists is very happy to honor you and to call you our IAPP National Mental Health Champion and to give you the Champion Award for 2023.
Thank you. I am indeed honored. Thank you. Well, thank you very much. Thank you very much.
Thank you. Thank you. You've been just such a wonderful partner for us, and it's been a joy, and we look forward to many more years of collaboration.
Thank you.
Thank you.
It's an honor.
Thank you.
Everyone, take this.